Good morning from London to everyone. Well, good afternoon and good evening to wherever you're calling in from. Thank you for joining us today for the second World Hepatitis Alliance webinar. And today we'll be addressing how to interpret and leverage results for effective advocacy, the HCV Quest Global Patient Survey. My name is Jeff Lazarus. I'm calling in from the University of Copenhagen, where I work, as well as at the journal Hepatology, Medicine, and Policy. And I'm joined today by three panelists. Let me show you who they are. Raquel Peck is the CEO of the World Hepatitis Alliance. Warm welcome, Raquel. George Kalamitis, calling in from Athens, Georgia. George is the chairman of Prometheus, the Hellenic Patient Association, Greece. And Bridie, the communications officer at the World Hepatitis Alliance. And before we begin, I'd like to let everyone know that you can send in questions throughout the webinar. So you're going to hear a series of presentations, but we really like to encourage a dialogue. And so using the webinar technology, you can send in questions that we'll be reviewing and posing to the panelists throughout the webinar. You can also send these in through Twitter. Those of you on Twitter know the World Hepatitis Alliance handle is @PEP_Alliance. And that you can do throughout the webinar as well. And also we'll have two polls, which I'll explain when we get there. But what the polls do is they allow you to interact quickly with us, and we get some results that we can discuss as a group. And finally, I'd like to let you know that we'll be recording this webinar, and later we'll be sharing the video with you. So our agenda for today is Raquel will be speaking on the importance of surveys as a tool for lobbying and campaigning activity. And she'll give an introduction to the HCV Quest Global Patient Survey that many of you are already familiar with. Then we'll hear from George a case study from his member association, member of the World Hepatitis Alliance. And finally, Bridie will be speaking on leveraging HCV Quest on a local level and give an introduction to the new HCV Quest Toolkit. So with that, let me thank everyone again for joining, and over to you, Raquel.
Thank you so much, Jeff. Okay, so let's jump right into it. I'm going to be talking, as Jeff said, about the power of data and also using HCV Quest, which is a survey that we conducted amongst people living with hepatitis C, as an example, and hoping very much that the NGOs that took part can maximize the findings and the results that they got, and the ones that didn't take part perhaps get inspired to do something similar. Right, so if we start talking about data, and I'm just having trouble advancing my slider, so I wonder if anyone can do that for me. Thank you. More and more data is becoming key to the world of advocacy, and that's because data makes our arguments stronger. It's just a very simple concept, and we're talking about not any data, but quality data, and also, which is very important too, it's about disseminating that data, because there's no use of you obtaining data and then sitting on it and not doing much with it, or not knowing the exact ways to package it or angles to use it, and missing opportunities. So one thing that we think it's very useful is about looking and strategizing when you're sitting down and thinking about how data can help your organization. There is a slide there just in front of you, and it's about that strategy. It's about what kind of arguments am I going to put forward, and can data help? And then if that's the case, where is data going to come from? Is it going to be doctors? Is it going to be policymakers, civil society, or members of the public? Then making sure that's reliable and finding ways to engage your people and the participants. Then moving on to, once you get the results, interpreting these results, and as I mentioned, packaging and looking at the stronger findings, and then finding ways to disseminate it. And by that I mean looking at Perhaps you want to do it at an event, looking at the timing to maximize it. Do you want to put together a press conference? Do you want to use an existing event to launch it? Do you want to use social media, for instance? Now, just before I talk about HCV Quest, I mean, like, when you're talking about all of these strategies, etc., it can be a little bit overwhelming for some NGOs, and some of you might be thinking, oh, God, I mean, like, it's great that you're saying go and get data, but we don't have the resources. So I just wanted to emphasize that getting data can be something that is easy, can be easy, and can be relatively cheap as well. So there are platforms out there like SurveyMonkey, for instance. They're free, and that can still give you that good quality data. And also don't underestimate the power of social media in terms of engaging your respondents and actually disseminating the information. So it doesn't need to be something that labor-intensive. Finally, and actually, let me just say, we're going to get into more details about all of these strategies when Bridie and George come in to give examples on HCV Quest. But let me talk about HCV Quest. This is a survey that was done, and again, for some reason, I can't advance my slides, so apologies about that. If anyone can do that for me, thank you. This is a survey that was done amongst hepatitis C patients and people living with hepatitis C. And we got about 4,000 responses from over 70 countries. And the great thing about this research is that it really showed us the impact of living with this disease. And also it showed us that the governments were not doing enough to tackle it. Now you might be going, okay, well, we all know that. That's not news. Right, but what this does is that it gives us facts. It gives us an ability to quantify this argument and make it stronger. So I'm just going to use it as an example, and that's my last slide. So if anyone can please advance my slide for me. This is an example of how you can make something that you already know become almost such a strong argument. So, sorry, I don't see the slide moving for some reason.
Raquel, I'm trying to move for you. Is this the slide, or do you want the next one?
Oh, that's the one. Thank you so much. So I just want to, that's my last slide, and I just want to give it as an example. So this research showed that 7 out of 10 people do not know that, what hepatitis C was before the diagnosis. Right, and that shows in itself that there's a massive lack of awareness. So you could easily just get this data, package it, and send it to your policymaker and say, look, surely we need to improve awareness. We need to do more on campaigns, on putting things out there. But there are going to be more examples that we're going to be talking about during this webinar. So I'm just going to stop here, if that's okay, and then we can continue the discussion. So back to you, Jeff. Thanks.
Thanks, Raquel. This is really powerful data. I mean, when you have 4,000 respondents, it gives the survey a lot of power. I know we're going to hear a little bit about the breakdown by country and how we lose some of the power as we stratify by country. But a figure like this, I mean, means that even with awareness campaigns, and even with a lot of people who might be aware of hepatitis and B and C in particular, that those being diagnosed aren't aware of their status means that we're also targeting the wrong people, and that's a typical problem. And this kind of data can help policymakers understand that you need targeted campaigns as well. And for people who are on Twitter, I just saw yesterday on the World Hepatitis Alliance's Twitter account that you had drawn attention to a study from the University of Bristol and the London School of Hygiene and Tropical Medicine on co-infection of hepatitis C and HIV, and some new numbers coming out. And there was a comment immediately from WHO that when you see these kinds of numbers, I mean, it's a real strong call for action, because we throw around a lot of numbers, but when you have the concrete research, it's so important. I'm going to advance us to a poll to get the audience involved, and we're going to ask you here, have you ever used the survey to support advocacy activities in your local area, so your city, your region, your country? So, have you used the survey, not just necessarily referring to other surveys, but have you, conducted a survey and used it to support your advocacy activities? And you can just punch in a yes or no, and I'll get some results here in the next few moments. 83% of people on this webinar have used the survey, which is great. And feel free to send in comments to us about how you use that survey as we continue in the webinar. I'd like to hand over now to George, who's going to tell us a little bit about the work they've done, the amazing work they've done in Greece related to their survey. George, over to you.
Well, good morning from Athens, Greece. Thank you very much for giving me the opportunity to participate in the webinar and giving me also the opportunity to share our experience using the HCV Quest. I think I was one of the lucky people that had the opportunity to show the first findings of the HCV Quest 2 years ago in a meeting in London. And from the first time that I saw the findings of this survey, I was very impressed, and I understood that this could be an extremely powerful and a useful tool in order to use it for advocacy and for raising awareness. Before I start with HCV Quest, I would like to share with you what is the current condition of hepatitis C in Greece and share with you a few numbers and data. So as you can see from this slide, of course, in the last 2-3 years after the new treatments, we have many surveys and many researches that happen in the country, and which has given us the ability to have a little bit more precise data of what is the prevalence in the general public, and what actually is the general picture of hepatitis C. And as you can see from this slide, there's 133,000 people approximately that live with the disease in the country, which is a 1.5% of the general population. So Greece is a middle to high prevalence country within the European Union. Of course, there's some controversial data lately with some surveys that show us that the number is a little bit smaller, and it approaches the approximately 100,000, which is, of course, less, but it is still a huge number. Of course, all surveys and all researchers that have been implemented in Greece, all of them agree in one issue, which is that the biggest number, the biggest percentage of people that are affected with the disease are unaware of the diagnosis. And every research agrees that and confirms that we are talking about a silent epidemic, and it will be an issue that we'll need to deal with it in the future, and we need to start doing things right now, because there are many people that are severely sick and are out there and have no idea of what's happening with their health. So as you can see, only almost 20% of the people of the total number are aware of their infection. And that, if you put it down in numbers, it is 25,000 from 133,000, which is a very, very small number. Of course, as you can see from this slide, what we need to do, and we need to do it right now, we need to start from yesterday in order to treat people. We have approximately 16,000 people that have severe liver damage, F3, F4 compensated, and M4 decompensated cirrhosis that need treatment now. And we have the ability to treat this big number of people. We have the ability to treat 16,000 people, but with the new DAs. But unfortunately, Greece up to today has restrictions to who has priorities to treatments. And according to these criteria, most of the people from just 16,000 that are aware of their disease, unfortunately, most of these people have no access to the disease, to the treatments. So, as a country, of course, we need to overcome the barrier that there is major issues that we need to overcome in the future. First is the issue that we need to put hepatitis to become a priority in the health system, in the health minister's agenda. We need to put hepatitis in a more higher level. And of course, we need to overcome the issue of costs and the issue that we are a country that is suffering for a severe financial crisis, and a cost is a major issue today in Greece. So there's two big barriers that we need to overcome in the future. Anyway, this is the current condition from with hepatitis C in Greece, and I would like to move forward to share my experience, our experience using the HCV Quest. So this is the methodology that we used, and as you can see, we thought in the beginning that we need to go to as many resources as possible in order to get a representative sample. Of course, as I heard before from Raquel, the SurveyMonkey is an extremely useful tool because it is extremely cost effective. We can use it through our social media channels, and it could go to every member that we have in our mailing list. And it is also very fast. Results are very fast. So by the time somebody gives 5 minutes to answer the quest, then you have the results and you can have immediate responses. But we thought that if we distribute the HCV Quest only through our media channels and through our members, we will have a biased result. Why is that? Because people that approach a liver patient association, actually the people that have already approached the Hellenic Liver Patient Association, are most of the times people that are experiencing some issues with the health system. They have experiencing issues of access, difficulties, barriers to access to diagnostics or barriers to access in treatments. Or they have experiencing problems with their relationship with the doctor. So most of them are people that are already unsatisfied. So we thought in order to have a representative outcome of the survey that we need to go to as many resources as possible. So we decided to distribute the survey to the biggest hepatology centers in the two major cities of the country, to as many as possible, and of course to distribute it to people and to places that we know that there is many hepatitis C positive people. So we used also the treatment center, the rehabilitation center, and the opioid substitution therapy centers that exist in the country.
George, can I just ask a quick question? I think that's really great what you're saying about getting a non-biased, opinion, and this is very important when you're putting your results out there. When you went to these treatment centers, did you get a good welcome? Was it okay? Was it easy for you to say, look, I'm just doing my survey. Can you help me? I just wondered, because if people are trying to do the same, it would be good to hear your feedback on that.
Of course. Thank you very much. It's an extremely important question. Thank you very much, because you're giving me the opportunity to share what's happening in my next slide. Actually, we needed to convince people to participate in this study, but we needed some very solid arguments. Actually, we were aware of what is the current condition, because most of the people that are members of the association are people that interact with the healthcare system every day. So we had a clear picture of what's happening out there. So the arguments that we used to them in order to participate in the HCV Quest, so the first argument that we used is that it will be the first time that patients have the opportunity to share their experience as people living with Hep C. And it was the first time that something like that is happening. It will be the first time that it will give us the opportunity to have a clear picture from patients and distribute it out to the world and share the message. What is happening with them? what are the effects of living with the disease. And the other one, it was also very important, extremely important, that we thought and we share with them that this will give us the opportunity to improve the healthcare system and especially the services that patients received from the healthcare system and especially from the clinicians. So these two arguments were extremely convincing to them in order for them to participate.
That's brilliant.
Great, and I see Bridie just returned. Welcome back, Bridie, and really good timing as we transition from the case study from Greece to your talk about leveraging the HCV Quest at a local level.
Great, thank you, and apologies for that. I lost internet connection at just the wrong moment. So yes, and as George has mentioned, sort of about the Greek study, there are lots of really interesting ways to be able to use this data in your country. As Raquel said, it was a global study, but as we were compiling the global report, we realized there were lots of really interesting statistics that had come out that inspired us to then go away and create reports that were specific for each country. So an example of that, in the global report, we discovered that in China itself, there were 75% of all respondents hadn't told anyone at all about their hepatitis C diagnosis, which we thought would be really powerful to then have this similar statistics for each country. So we decided to produce these country reports and look at what was going to be important for each of these countries. There was a total of 22 country reports, and these are the countries that it covered. So these were all the countries where we had a significant number of responses. Unfortunately, we did have, as Raquel said earlier, we had responses from as many as 73 countries, but of course some of these countries quite small, and we only had a few responses. So this is all the countries where we had enough data, enough responses to be able to actually find these percentages. And each report is available in both the native language, so the Argentinian one is in Spanish, and each is also in English. And they all focus on what's really going to be interesting in that particular country. So they
Bridie, let me just ask a quick question.
Sure.
So you have your responses from 70 countries, and you have 22 reports. Can we expect some of these surveys to be continued to get enough people to have more reports, or is it something that's going to be launched in a couple of years again? Because I've looked through a few of these reports, and it's fantastic tools. We already heard from George about the incredible effect they can have in a country, and as a global response, they have a powerful effect. But I mean, at the country level, to be able to say, I have this report from my country. It's an excellent tool as you're describing. So are more on the way?
Unfortunately, the survey now is finished, but what we would suggest is countries that haven't, we didn't have enough response to create a report, we would recommend that people go away and use the tools that Raquel's mentioned to create their own survey. If anyone's interested, they're welcome to contact us and we can provide the questions. So an example of the type of questions that you can base your survey on. But these country reports are really all the countries we were able to produce reports from the data we got.
Thanks. I know, where I'm based at the University of Copenhagen in Denmark, we sorely need such a report, and we heard that this kind of survey can be done low cost, maybe not in our university setting, but maybe led by patient groups and using free online tools. So I think it's a great opportunity and fantastic that you're able to help people along.
Absolutely. So as I mentioned, these reports, they cover a number of different aspects. So we've already talked about the awareness that they talk about. There's lots of statistics on stigma and discrimination. And there are a number of different ways you can use these statistics. So you can approach government and sort of really lobby for a better healthcare response. Much of the data shows that really there needs to be a lot of improvements in the way patients are dealt with through the health then by asking governments to reassess their discrimination policies. As we've seen from the data, people are having issues at work or in education. Surveys are also quite good to approach media, and this could be to raise awareness about hepatitis or to pressure the government to really be doing something. And so much of the surveys show, as I say, that patients aren't necessarily getting the support that they need from their doctors. So using this data, you can also start to build conversations with doctors and healthcare professionals. And one example of this is we've just taken one example of how you would perhaps use a specific statistic to what to do with it. So this is an example from the Argentina report, where we found out that not a single person who had responded to the survey had heard about Hep C from a government awareness campaign. This is a really interesting opportunity. If you were on the first webinar where we talked about using policy documents, this is a great example of how you can use the learnings from the first webinar and then also combine the learnings today about using survey data. So we know that in 2010, at the World Health Assembly, every member state committed to raising awareness of hepatitis in the resolution. But this data quite clearly shows that not enough is being done. So armed with this statistic and then also using that policy document, you're able then to really sort of hold your government accountable and really say that they're not doing enough.
I was just going to say, I think it's great that you can link the findings of the survey to the resolutions that governments have committed themselves to, because it's really the job often of NGOs, patient groups, to be the watchdogs and hold their governments accountable. So here's one example, and I'm sure there's dozens of them. And I mean, we're going to turn to George to tell us a little bit about how they did that really in a strong style. So George, do you want to tell us a little bit about how you used the HCV Quest in your setting in Greece?
Well, we had the opportunity when we had the final results. We were extremely lucky enough that we were invited to share the findings in the biggest hepatology conference that happens annually in Athens, Greece. And of course, it's a more clinical conference that more clinicians are invited there and a few people from civil society. But this was extremely challenging because the things that we wanted to share with them were actually had a lot to do with the relationship that the patient and the doctor have. So one of the very, very interesting findings of HCV Quest, which was actually it was an experience that was never shown with numbers, but it was an experience that most patients have, is that we have a dysfunctional relationship with our clinician. And that obviously has to do with the personality of the clinician, but it has to do with the conditions of the healthcare system that the clinician works and the patient is approaching. So the findings were, as you can see from the slide, 1 out of 5 patients are completely unsatisfactory, characterize the communication with the health professional completely unsatisfactory, which is a big number. 1 out of 5 are very upset when they come out and away from the doctor. 55% participate in the treatment planning, which means that 45 didn't participate in the treatment planning. And 21% was not even asked their opinion about treatment, which is very important nowadays because one patient might have the ability to wait or not to wait, but 21% is not even asked about it. So when we presented this data in the conference, of course we had huge arguments from the audience. There were 400 clinicians over there, and the feedback that we got is that, unfortunately, we work in a very, very bad conditions. We have a very huge load of patients that approach us, and there is this very limited time given to the patients, and it is approximately 5 to 10 minutes. So, of course, in a 5 to 10 minute session, of course, you cannot answer all these little important or less important questions that the patient brings up to the session. So this was an issue that was highlighted in the conference and was very important. But the second finding was also very interesting, because we clinicians and us agree that we have a dysfunctional health system that does not give the opportunity for a healthy relationship between doctor and patient. But the finding of the 2% of patients referred by the health professionals to the patient association at the time of the diagnosis was, brought up questions, because we have a very functional liver patient association in the country that clinicians know about it. And this is an issue because they claim that they don't have time to answer and give time to the patients. But in the same time, they are not referring the patients to the patient associations, which we can provide them with, a few details and support for their disease. So from these findings and from this survey, we agreed in that conference that we need to work on the relationship of the clinicians with the Liver Patient Association. That is, and it may become clear that it is a benefit of both, and patients and clinicians. So after 1 year, because we are operating a helpline here that gives us data, in the last year we have a significant increase in the numbers of patients that the first person that tells them about the Liver Patient Association is the doctor. So it is something that we found out from the survey that it is a huge problem, and we worked with the cooperation with the clinicians, and we are trying slowly, but we are trying to resolve it.
Again, I have to say, because this is a situation that we as the Alliance, we've been hearing from so many other countries, and I'm pretty sure that it echoes the whole patient and doctor relationship. What you said, George, around doctors having only 10 minutes because they're so busy and not offering the quality time perhaps to the patient, but at the same time not referring them to a patient group. I think this is being seen in a lot of countries. It's just fantastic to see that you were able to present it, the results to them, and they were receptive of it, and they're working with you. So hopefully that inspires other NGOs to be reaching out to the clinicians and doctors associations, because what we don't want is patients leaving the clinic and going to Google and perhaps finding resources that are not credible and then getting bad information out there. So it's very encouraging to see that. I just wanted to add.
Of course, we need to stay away from Dr. Google. And second of all, what's happening was very interesting. That it was in the conference we decided. We went with the agreement with the Hellenic Association for the Study of the Liver, and we decided that every pamphlet, leaflet that the association has and poster should be distributed in every clinic around the country, and every doctor agreed. So that's why it's more easy to them to provide a pamphlet, leaflet with a telephone. That's extremely important, because the patient, if he leaves unsatisfied with the doctor, most of the time he will become warehoused and disappeared from the healthcare system, because it is a disease that's well known, which has no symptoms, so it doesn't affect directly right now your life. You are not aware of it, so it is you need to stay in touch with the patient, not not solution.
George,
So
there's a question that came in that asked what kind of media you targeted in addition to targeting the clinicians.
What type of?
What kind of media? So in addition to the clinical conference where you presented, I guess, did you approach newspapers, magazines, journalists with the survey, with the data?
Yes, we had, of course, a few press releases of the findings of the results. We distributed in our media channels. We made several. We talked to journalists and writing articles, because we wrote some articles and published it it was so extremely interesting because it was the first time of patient's voice. So we used it as a unique experience to show this data to as many media channels as possible. But the impact that I showed, that we experienced in the conference was unique because it had an immediate act.
Okay, thanks. Did you use the radio by chance?
Radio and TV, yes, of course.
Oh, fantastic. That's great.
So the second findings of the HCV Quest was extremely important and showed that there is a significant impact of HCV in patients' lives. And then we saw that there is a huge issue of stigma, a personal stigma that exists in every patient, and a stigma that the patient experiencing from others. So the findings show that 17% revealed the diagnosis to their colleagues, which is a very small number, as you can see. And 43% feel uncomfortable to disclose the diagnosis to their employees. So this was extremely important, and we thought, but this is extremely depressive when you see these results, because we are talking about a curable disease. A very easy curable disease nowadays. And if you are aware of the disease, what makes us skeptical and what makes us, very disappointed? We have a disease that is curable, as I said. If you are aware of it, you can deal with it in a short period of time. But on the other hand, stigma is a situation that is killing you every day, and might create a bigger damage even from the virus itself. So this was some findings that were hugely presented. And of course, through these findings, we also became aware that we need to work a lot more in order to raise awareness and to push the government to implement campaigns and to raise awareness about the disease. And of course, the third finding is that there is a significant impact of the physical and emotional and psychological health of patients. So all these data were, used in order to grow and push in order to implement an awareness campaign in the future with the cooperation of the government.
George, it's an interesting comment you said about this being an easy disease to cure, and it's important to to be aware of your diagnosis. Because earlier on, a lot of people were saying, why test if we can't get treated? And I always felt that, well, if more people are aware of their diagnosis, you have larger patient groups, you have a larger cadre of advocates. And I think things are really changing now with the advent of DAAs. And in the case of Greece, correct me if I'm wrong, it seems that even though you have very strong restrictions on who can access the new medicine, as you have more people aware of their diagnosis, you'll be able to get more pressure on the authorities to make it more available. Is that a correct read of the situation?
Correct me if I'm wrong, but I understood that you said that there is many patients that are aware of it, but very few have access to them, and that has brought up a lot of pressure. It is correct. Of course, it is correct. Imagine that we managed to treat only 700 patients last year, in 1 year, and there's 25 demanding treatments right now, 25,000, which are demanding, and they are F3 and over. So they are severely affected from the disease, and they are demanding now treatment. And we're not talking about warehouse patients that have been lost in the system. We're talking about patients that are aware of the condition, are severely affected from the disease, and demanding to the doctor and to the health systems. And that's why we had approximately last year, only as a Liver Patient Association, we had approximately 300 people that got rejected from the healthcare system for new DAs, which was a huge number. That also had a lot of publicity in media.
Great. I'm going to remind everyone that you can still send in questions, and you do that by typing it in the questions section on your meeting control panel. And one question came in, George, so I'm just going to go back a slide to these figures. And it says, how do these percentages differ from other diseases in Greece? I don't know if you did any kind of comparisons. I mean, is the situation worse for hepatitis than for some other diseases? The same? Is it an unusual situation that we're seeing here and even, back here on the previous slide?
Of course, when you're talking about this slide, when the relationship with the clinicians and doctors, I think most of the clinicians and patients are unsatisfied with the relationship in between them. Both clinicians and patients, regarding the disease, are approaching the same healthcare system, which is, extremely overloaded. Many people, the budget of the doctors, their salaries are falling down. They are satisfied with their work. They are satisfied with the environment that they work. So I guess, and not only I guess, I know that people that suffer from cancer or other diseases are experiencing the same issues with the doctor. Now the other slide, which was talking, the other slide with the 17%, I have no clue of what's happening to other diseases, because some of them are not followed with stigma. We can, of course, in hepatitis B, it will be the same results, I believe, because hepatitis C and B, people outside the world do not understand as much as the difference, especially the ones that are not very well educated or have not many information regarding the disease. But I think the first slide that describes the relationship with the doctor, I think the situation is similar. But I do not know how in the other areas, if they have a patient association that is, willing to help.
Well, I don't think we should necessarily go for the lowest common denominator, but it is interesting to compare the situation of hepatitis, if not with all diseases, at least with similar, like you said, stigmatized diseases, or where there is discrimination, which is why the workplace question is so important. Not that you have to go out and share your diagnosis with your employer and your colleagues, but if there's, but can you is really the question. I think that would be an interesting question to look at. Another question came in that could either go to you, George, or to Bridie, and it asks, what problems have been encountered when carrying out the surveys so far, and how could they be overcome? And I guess there's a whole range of issues you ran into in Greece and globally, methodological issues. We already heard some countries had low response rates, but what other specific issues did you encounter? Maybe Bridie, if you have some maybe global perspective, or George, if you have something particular to Greece?
Yeah, absolutely. I think one of the biggest things is really identifying your audience and how you're going to target them. So we put out the survey through social media and through various patient groups to our members. But actually what made the most difference in response rate was actually contacting doctors and nurses who were able then to ask their patients to complete it. And that was actually how we got a lot of the responses we did. So I think identifying how you're going to get the survey out is really important. One other thing I'd really advise to be aware of is the length of your survey. Those of you that completed HCV Quest, you might remember it was actually quite a long survey. There were around about 50 questions. So it took quite a long time, probably about half an hour, 45 minutes to actually complete. Which it does mean we've got now a huge wealth of great statistics, but I'm sure that it was perhaps off-putting to people to complete a survey of that length. So I think when you're compiling your own survey, really
And actually, that was one of the points that we were criticized about, where we have to say, because, and that's going back to surveys and how the strategy, as Bridie said, around how many questions and what kind of questions is so important. But we did have some patients that said, you can't expect us to spend half an hour, doing this. Why don't you just ask 10 to 15 questions that are pertinent? So going forward, this is a learning for us. We will definitely be doing surveys with less questions. So we are learning as well as we go along.
Oh, this is good to hear, because I'm sitting with a hepatitis survey that's 45 questions, and you're making me very, very, very nervous. Let's turn back to Bridie to talk to us a little bit about the HCV Quest Toolkit and the resources it includes. Because, whether or not your country has a specific report, there's incredibly powerful global data that can be used. And with all that information, it's great that you've been developing a toolkit to help people actually, use it. Because now the hard work was maybe finding that half an hour to fill it in, but the really hard work now is telling the story of hepatitis in your country and globally. So Bridie, over to you.
Absolutely, thank you, Jeff. So as George has talked about, when he was, he had some really great responses from when he delivered the presentation on the findings at the presentation. So we really wanted to make sure that we produced the tools that made it as easy as possible for you to make sure you can get the survey findings out and really put them to use. We've developed this HCV Quest Toolkit. All the resources are completely adaptable. So even if you haven't got the country-specific data from HCV Quest for your own country, or perhaps if you work in a perhaps hepatitis B, or even want to just talk about something, carry out a survey that talks about something other than Quest, the templates can still be used. And the principles of reaching out to the media and lobbying governments are all the same, so these are really quite adaptable, flexible resources. It's an online hub, so all the resources can be downloaded directly from the hub, and there are many, many different ones. So just a few, there's a press release. I'm just going to mention a little bit later about how you can use that alongside us to really maximize the impact of these findings. There's also an infographic, which is really quite visual and a great way to share findings on social media or approach traditional media. And then there's also an external presentation, which George, for his presentation, obviously used the data, but this is similar to that. If you're attending an event, you've even got this presentation set out already where you can just change the statistics to fit your country. And one of the ways in which we wanted to make sure you could use these resources is by showing the different types of opportunities you have to make use of each of the tools. So, for example, there is lots of ways you can use this on social media, whether that's just simply sort of posting around it, using hashtags, or you could even perhaps, an example, you could create a Twitter chat if you've got an interesting spokesperson. You may gain attention and give people an opportunity to ask questions. They also have opportunities to have a spokesperson or a high-level sort of thought leader write a blog on the findings. And survey findings are also quite a good opportunity to approach the media, and particularly when the media perhaps might already be talking about the topic or looking for stories. It may be a really good opportunity to get these statistics out. And there's actually an opportunity coming up exactly like this, and this is where we want you. So, as you may know, the next sort of big milestone in the hepatitis calendar is EASL International Liver Congress, which is taking place in April. And obviously, some of these findings have been out for a little bit of time now, but the country reports have only recently been launched last week, and these resources are now what can really amplify them. So we're suggesting that each of you go onto the Resources Hub, download the press release, enter your country-specific data from the reports, and then together with us at the same time, so on the 13th of April, send out this release to your local media outlets and we'll also be doing the same on a global level. So this way, then, if we're all going out at the same time, we're really going to be able to maximise the awareness of these findings and really amplify the reach that these findings have. We'll be able to provide more information very soon on this, but it's a really great opportunity to sort of get stuck in with the resources hub, check out the resources, and really use it all together.
Great, thank you. This is a huge opportunity to really leverage the International Liver Congress, the ILC, which is really just about a month and 3 days away. And it would be great to see a lot of patient groups sending out a press release that same day and really clogging up and filling the social media and other media with this kind of important information and get hepatitis really up there at the global level. George, a question came in related to that. It says, can you give examples on the different angles on HCV in the media coverage in Greece? So the different angles, how have they discussed HCV in the media in Greece? What created the most media interest is the question as well.
Regarding are you talking about regarding the numbers of the outcomes of the survey?
Well, it's a question from the audience, so I'm not sure, but I would say from the survey it would be interesting, but then maybe just a quick comment in general, what does the media focus on when they focus on HCV?
Okay.
But from the survey, what was...
This is a very easy question. This is a very easy question. Yes, well, when you are experiencing so very strict restrictions in patient access, as you understand, this is something that the media are very interested in. Because when somebody, of course, when he's F3 and he has never experienced treatment before and he's rejected by the healthcare system, that's an issue. And of course, the issue of the cost, and of course, the issue that there is not still an operating negotiation committee in order to bring down the prices and give access to patients. This takes the biggest percentage of the media pie.
Okay, thanks. Let me see if there's any other questions. We're in our last few minutes. Here's another question. This one's for Bridie. How long will we have access to the online hub and materials?
So in its current format at the moment, with the way it's set out, will be available for at least a year. So really, it's pretty indefinite. And then after that, we'll also be exploring other ways to sort of put those things online and make sure that we get them out there to you. We've got lots of plans coming up over the next few months of similar other capacity building and sort of toolkits. So I'm sure by the time that sort of the HCV Quest Toolkit as it is at the moment, by the time that's up, we'll have all sorts of other places to put these resources. So really the answer is as long as it's up.
Great, fantastic. Well, we are really just about out of time now, and I'd like to thank the three panelists so much. Raquel Peck, the CEO of the Alliance, giving us an introduction to this great new tool, and George sharing, a real example from the field, from Greece, and what you've done, and how you took this survey and the results to a clinical conference. You said you had almost 400 people in the room and engaged with them, which isn't easy for patient groups. And I think for patient groups that don't have the ability to do what you did, using the global data can also be a very powerful tool. And we heard from Bridie that both globally and nationally, it'll be really important on the 13th of April to release press releases or make comments on social media, make sure there's links to the new resource hub and toolkit on your website, and raise that awareness around the time of the International Liver Congress, where around 10,000 people will come together. That includes advocates and patients, but as we know, it largely includes medical professionals and doctors. So this is a chance to really be there, even if you can't physically be there. And let me remind everyone again, well, firstly, thank you for sending in the questions and comments. There were far too many questions for us to address, but that's a good situation to find ourselves in. We've recorded the webinar. We're going to make the video available to you so you can use it, share it, revisit it. And The slides will also be available. And finally, this is the second webinar in the Alliance's Tools for Change series. We have a third webinar scheduled for the 4th of April, and that will be on the subject of awareness as a policy lever. So we're going to do this current webinar, again, live tonight, one more time for those who are asleep earlier than us. And our next webinar, as it's shown here on the slide, is the 4th of April. So please sign up. Please share the news with your colleagues. And thank you again for joining us today.
Thank you.
Thank you.
Thank you all.